no such thing as a 4-minute mile. When we didn't walk on the moon, when there was nothing known as the internet. There's all these things that people would have thought were impossible until today. You know, everybody has a cell phone. Raise your hand if you don't have a cell phone. Okay? So there was a time when, you know, back in the 80s, when you had that big brick cell phone and only, you know, 1 or 2 people in the whole city had one of those things. Now everybody has it. You can't even find a payphone anywhere. Okay? So we want to talk about living an active, healthy life. And for the purpose of today's discussion, we're going to talk about living to 100 years and beyond. Now, sometimes I talk to my members in my practice and I'll say, you know, it's great. More people are living longer. Isn't it great that you have the possibility of living to 100? And sometimes I'll hear, I don't want to live to 100. And so my next question is, why not? Why wouldn't you want to live to 100? They say because, you know, their impression of living to 100 is walker, wheelchair, in a home, things like that. So their health isn't as good as what it should be. So they expect to live to 70, 80, 90 years, and life deteriorates after that. It doesn't have to be that way. How long can the human body last? Researchers say at least 150 years. 150 years. Can you imagine that? Right? How does that possible? Well, there's a genetic intelligence that the body has. Genetic intelligence is your body's blueprint for life. All right? And then as you grow, as you age, as environment exposes you to various entities of stress, the body deteriorates. Okay? But if we talk about today's centenarians, which are 100-year-old people, when they were born, they had the life expectancy of 50. They didn't know they were going to live to 100. Right? So if you knew you were going to live to 100, or you knew that your life expectancy was a certain level, wouldn't you do more things to take better care of yourself? Because they didn't have that knowledge that we have today. Right? I always like to talk about George Burns. If I knew I was going to live this long, I would have taken better care of myself. Right? What will your health be like when you get there? Because you don't have control over how long you live, for the most part. Right? But what decisions can you make today that will enable you to have a healthier life down the road? And that's where wellness comes in. Now, let's talk about the centenarians. 1 in 10 people today is 60 or older. By the year 2050, the ratio will be 1 in 3. There are currently 70,000 people over the age of 100. By 2050, there will be 4.2 million. What's that going to do to our healthcare system? Okay. Centenarians are the world's fastest growing group, whose numbers are increasing 8% per year. You can look at the morning news shows with the Smuckers sponsorship for the centenarians, Willard Scott. And it used to be, oh, you know, 100, 101. Now you're seeing 109, 110, 111. I saw one for 114 the other day. So more and more people are living longer. These are good things. So when we talk about overall ability of the body, we talk about genetic intelligence. Okay, that's what you're born with. That's your body's blueprint I was talking about. That's the guideline of how your body is going to develop over the years. And some of it's genetic, but also a big portion of it is environmental. And what we're finding today is more and more environment has a lot to do with how your body expresses that genetic intelligence. Okay? It's not about quantity. It's not about just living to 100. We can only live to 95. We want to live to 95 as healthy as possible, as active as possible. We want to enjoy our family, our grandkids, our great-grandkids, the generations that are coming after us. What affects the body's ability to live longer? Chiropractors always talk about interference. What chiropractic was founded on was not back pain. The first adjustment was given to someone who was deaf. Okay? Guy didn't come in and say, hey, I have back pain here. He couldn't hear, and the first chiropractor, Dr. Palmer, gave an adjustment to him. He got his hearing back. Now, does that mean we cure deafness? No. It just means that he had a condition of the spine that was creating enough interference to the auditory nerve that it decreased his ability to hear. That's what chiropractic was founded upon. How many of you knew that? How many of you thought it was back pain, neck pain, headaches, that kind of thing? Right? Okay. So our philosophy of health is that the nervous system controls everything in the body. We'll talk a little bit more about that. The more interference you have on that nervous system, the harder it is for your body to stay healthy and to express the body's genetic intelligence. Deepak Chopra, anybody heard of him? Heard of his book, Quantum Healing? All disease results from the disruption of that flow of that intelligence. In other words, If your computer is overloaded with software beyond what the memory you have in that computer, it's going to lock up a lot. You're going to have to reboot a lot. It's going to make a lot of errors as far as overloading the system. The computer's fine, but it's overloaded. It's always operator error, right? Isn't that right? Three types of stress that we talk about that creates interference in the body: physical, chemical, and mental or emotional. Physical component: trauma, bend, twist, lift, push, pull injuries, sports injuries, auto accidents, all sorts of different things that can happen to the body physically. Heart disease, these types of things. Chemical, medications, environmental stress, those types of things that we're all exposed to. Nutrition, that's how nutrition helps the body, right? The worse your nutrition is, the more interference you're going to have on the nervous system. And mental. Mental's a big one, because if I were to take a survey in my practice back 18 years ago and looked at the progression of antidepressants and anti-anxiety medications, you're going to see this happen. Now what's happening, you can just watch TV and you'll see all the commercials on all the antidepressants that are out there. That's because they're the #1 prescribed medication today. People come in with chronic pains, they put them on antidepressants. Then the antidepressant doesn't work, so they give them another medication to help that antidepressant work better. And the concern there is obvious, especially younger patients. We see younger patients come in and more of them are on antidepressants. It becomes scary. There's an underlying problem here. But that is a huge chemical stress that's being used to treat a mental stress. So it's hard to think about living 100 years when you're full of stress, whether it's that emotional component, that chemical component, or the physical component. In our society, because of the type of work that we do, most of it becomes chemical and emotional or mental stress.